I sort of feel like being a soldier on the front line of a war and the opposite army is charging at us and we don't know when they're going to hit.
Things change by certainly on a daily basis, but almost on an hourly basis.
I've been doing ICU work for about 11 years. And so I've had a lot of experience, but on the other hand, I've never taken care of patients with COVID-19.
We work as a team. No one complains. Everyone feels like they're doing their part.
Communities do one or two things. Either they can panic or they can rise up and provide solutions.
But so far, it's just been day to day, just get as many people taken care of as possible.
We've felt this giant earthquake in Asia, and we are wondering if and when the tsunami is going to follow that earthquake.
Once it became a reality in Wuhan, then we said, what if that would happen in Albany, Georgia, what would we do?
The doctor makes what's called a differential diagnosis, where you make a list of likely causes or likely diagnoses for the symptoms in the order of the most likely first and then down the line of what you think it could be. And coronavirus is kind of at the top of every differential that I'm making for every patient, for every symptom and every problem.
One of our wards in-house now has become a COVID ward for just COVID positive patients. And we've repurposed some of our ICUs to just take care of COVID positive patients.
We've had surgeons saying, hey, we've cut back my elective surgery schedule. I have time. I can help you round on patients, help you see patients. Now,
but let me tell you a couple of limitations that we see. One, we don't have enough tests right now.
Almost 2 months since the first infection appeared in the US, we're still hardly testing anyone, which has been a pretty horrifying realization for me.
Because we certainly missed a lot of patients who were probably COVID positive, and we just had no ability to test, and they just went home, and we're not out of the woods. So
it's like really nerve-wracking to tell someone, listen, you might have COVID-19, we can't test you for it, but the best thing you can do is stay at home for 2 weeks.
It seems like every day we learn about a new celebrity or a new professional athlete that got tested, even though perhaps their disease wasn't that severe. And yet I can't get results on my patients. I've been swabbing people for about 1 week, and I still haven't gotten a result yet.
We're also going to run out of the personal protective equipment that we use.
Nobody wants to be in the situation 2 weeks from now of saying, okay, well, go into that room with that critically ill respiratory patient, and I'm sorry, but we don't have a mask to give you. And it won't take long to decimate our healthcare workforce if we're faced with that situation. So.
And I expect every hospital in the country to be overwhelmed to some extent. So it's just a waiting game, basically.
They say it's still building up, that we still haven't peaked in New York or in the US, but I truly don't know.
This is going to be a marathon. It's not going to be something that here Tuesday, gone Thursday.
I've learned the limits of what I know, but I've also learned what a wonderful community of healthcare providers there are that are caring for this disease.
I'm really proud of our team right now where I'm working. Every day, everyone suggests something to change that will improve, keeping the virus contained.
My hope is that this does something to unite the country, since it is a common enemy.
And I think the attitude is, this is what we are here for, and we're going to take care of the community. We're going to take care of ourselves the best we can, but we're going to take care of people. So
the time we have together, and with this dark cloud looming over us, I feel like it's made me more mindful and appreciative of what we do have, and what really matters in keeping our community and our loved ones safe and healthy, and how lucky we are to have our health, those of us who do.